Hey everyone, it is Dr. Kyle, and here today to talk to you about a thought of the week and specifically the chiropractic effects on blood pressure. Now, this is important. I think most of us know somebody or deal with it ourselves, high blood pressure. In fact, statistically, the last stat I saw was 1 in every 3 Americans is dealing with hypertension to some extent. And so we need to look at every opportunity to lower blood pressure naturally without needing to rely on a medication that directly affects the cardiovascular system and has other ranging effects in the body. In fact, blood pressure medication is one of those medications that once you're on, it tends to be considered a lifetime medication. And so the longer you're on most medications, the longer that those effects get compounded and there's more likelihood for risk. So I say all that to say that chiropractic is one of the ways to offer a possibility for improving blood pressure in somebody that may be borderline or is that concern, and so that they likely don't have to or they lower the risk of needing to be putting on one of these lifetime medications with a high risk of negative side effects. Specifically, for over a decade now, going back to the early 2010s, there were multiple studies done that showed that chiropractic care lowered blood pressure consistently, even after several weeks after an adjustment is done or after chiropractic care is received. The studies that were published in medical journals showed an average of a 14 point drop in the systolic number, which is the first number when you think blood pressure, and eight number drop when it comes to the diastolic, which is the second number in your blood pressure reading. So those are pretty significant drops. In fact, there's very few things that replicate that outside of medicine. Now, there's two ways to look at how chiropractic affects blood pressure. The first one is just functionally, the very top bone in your neck is called the atlas bone. It supports the weight of your skull. It's also the area where there's like the vertebral arteries that carry fresh oxygenated blood to the brain. And most importantly, it's protecting the brainstem and the first spinal nerve that control blood pressure. And so by releasing pressure on the very top of your neck, right at the base of your skull, by removing that subluxation, allowing that nerve to function properly, that goes a long way for many people in regulating blood pressure. The second thing is to understand that really throughout your entire spine, if there's any area where there's subluxation, where there's interference, there's inflammation, there's injury to what's called the autonomic nervous system. And the autonomic nervous system is the part of your nervous system that controls the things that you don't think about on a daily basis, your heart rate, your blood pressure, your breathing rate, things like that. Whenever there's injury throughout the body, and especially as those build up over the years, adjusting and removing that subluxation in multiple areas, even if it's your mid back, your low back, your neck, any one of those or a combo is going to lower that autonomic response, that autonomic nervous system, which then lowers your blood pressure as well. So there's both a very specific area that your doctor can look at for blood pressure, as well as just an understanding that general spinal health goes a long way to reducing as well. So if you are somebody that's being adjusted already, congratulations, you're doing one of the most effective ways to naturally lower blood pressure and lower the risk of needing to medication for that. If you're not being adjusted currently by a chiropractor, please seek out care and find out if this is an appropriate way to help manage blood pressure concerns. Have a great day.